Oklahoma politicians love to talk about choice, freedom, fiscal discipline, and smaller government. But choice does not mean much when a family cannot afford the doctor, the medicine, prenatal care, mental health treatment, or a hospital close enough to reach in an emergency. Slogans do not pay the bill. The conservative promise was lower taxes, smaller government, personal responsibility, and stronger families. But health care tests that promise because illness does not care about political slogans. A pregnancy, a premature birth, cancer, diabetes, heart disease, addiction, or mental health crisis still has to be treated. Cutting health coverage does not cut illness. It shifts the cost. Families delay care. Hospitals absorb unpaid bills. Churches and charities try to fill the gap. Local taxpayers help carry the consequences. Rural communities lose services when the healthcare math no longer works. SoonerCare is not some side issue. It is part of Oklahoma's healthcare foundation. It covers about 1 in 4 Oklahomans, and it pays for about 6 in 10 births in the state. That means when politicians talk about cutting or weakening Medicaid, they are talking about children, mothers, seniors, people with disabilities, and low-income working adults. They are talking about Oklahoma families. That means Medicaid is not separate from maternal health in Oklahoma. It is one of the main ways mothers and babies receive care before, during, and after birth. If the state weakens SoonerCare, it is not just cutting a program. It is weakening part of the system that protects mothers and babies. Oklahoma already has warning signs. Life expectancy is only 73.8 years, about 71 for men and 76 for women. That is lower than Mexico's roughly 75-year life expectancy. In 2023, 341 Oklahoma babies died before their first birthday, an infant mortality rate of 7.1 per 1,000 births. More than half of Oklahoma counties are maternity care deserts, meaning they lack basic maternity care access. And one analysis found 22 rural Oklahoma hospitals at immediate risk of closing in the next 2 to 3 years. This is not the place to pretend that fewer healthcare dollars will somehow produce stronger families. When coverage shrinks, rural hospitals feel it first. They face fewer paying patients, more uncompensated care, more service cuts, and more pressure to close departments or close altogether. The bill does not disappear. The community pays through longer drives, fewer doctors, weaker emergency care, and less economic stability. For many families, medicine is not optional. Insulin is not optional. Heart medication is not optional. Cancer treatment is not optional. Mental health care is not optional. Prenatal care is not optional. When care is delayed because families cannot afford it, the health problem gets worse and the final bill gets bigger. Here is the double standard. When Medicare negotiates lower prices for seniors, they call it government interference. But when drug companies keep charging high prices, they call that the free market. That is not fiscal discipline. That is protecting the seller, not the patient. A real budget should ask whether healthcare policy keeps families healthy, keeps hospitals open, protects babies and mothers, and lowers long-term costs. That is fiscal discipline, not pretending costs disappear because the state pushed them onto someone else. A conservative health policy should ask who gets care, who loses care, who pays when care is delayed, and what happens to rural hospitals. No slogans. Show the cost. If the state saves money by pushing higher costs onto families, hospitals, and local communities, that is not fiscal discipline. That is cost shifting. Healthcare costs do not disappear. They move to families, hospitals, rural communities, charities, local governments, and taxpayers. Oklahoma does not need another slogan about freedom. It needs honest budgeting, healthier families, stronger hospitals, and leaders willing to stop calling a shell game fiscal discipline. Follow the money at wlangdon.substack.com.